Hello, my name is Samuel Northup. I'm in Chem 1031, Section 3. For my Capstone project, we'll be talking about how do ACE inhibitors relax blood vessels. All right, so what are ACE inhibitors? They are medications used to treat heart disease, such as hypertension, which is high blood pressure, coronary artery disease, kidney failure, and other related diseases to heart issues. Now, here's a list of ACE inhibitors. They're all taken orally, except for an allophil, which is taken through IV. So what is ACE? ACE stands for angiotensin converting enzyme. And what this does is it raises high blood pressure through two different ways. It converts angiotensin 1 to angiotensin 2. And it also is responsible for the breakdown of bradykinin, which is a protein that lowers blood pressure. And I will explain what angiotensin is on the next slide. So angiotensin is part of the angiotensin aldosterone system. There's four different types of angiotensin, but angiotensin 2 is the one that is the most harmful. And then angiotensin 1 is converted to angiotensin 2 by ACE. And what happens is when angiotensin 2 is increased, it leads to the vasoconstriction of blood vessels, which narrows them. And then it also triggers the kidneys to release aldosterone, which then increases sodium retention. And then antidiuretic hormone is secreted from the pituitary gland, which then increases water retention. And then all three of these things together lead to that increase in blood pressure. So why is high blood pressure dangerous? So hypertension, which is high blood pressure, is defined as a systolic blood pressure, which is the pressure in your heart during contraction over 130 micromillimeters of mercury, and a diastolic blood pressure, which that would be the pressure in your heart when it's relaxed, of over 80 millimeters of mercury. And then when blood pressure is basically the force that your blood is exerting on your arterial wall. So when that's higher, your heart has to work harder. As I said, the workload on the heart is increased the higher blood pressure is. And also high blood pressure puts more stress on the kidneys because blood has a harder time getting through the kidneys to be filtered. So they're under stress for a longer period of time, which, like I said, which I mentioned before, is why high blood pressure can lead to kidney disease. And also high blood pressure leads to an increased risk of heart attack, stroke, and kidney failure. So how do ACE inhibitors work? What they do is they inhibit the conversion of angiotensin 1 to angiotensin 2. And this allows blood vessels to relax and vasodilate, which then will lower blood pressure. And see, I have a picture down here of what kind of a constricted blood vessel looks like versus a relaxed blood vessel. As you can see, the lumen or opening in the relaxed blood vessel is much wider, allowing for more blood flow, which then will lower that workload on the heart. So the side effects of taking ACE inhibitors, one that is very dangerous is hyperkalemia, which that is a increased blood serum potassium levels. And the reason why that happens is because with ACE inhibitors, sodium excretion is increased and then potassium is retained more. So that increased levels of potassium can lead to cardiac arrhythmia and heart failure and other diseases. This can be monitored through regular blood tests and just making sure that you're not exceeding those potassium levels. And then hypotension is another side effect that can be reached, which that's just low blood pressure. And also dry cough, dizziness, fatigue. And also if you're taking NSAIDs, which are like ibuprofen and Advil while you're taking an ACE inhibitor, those will lower the effects of an ACE inhibitor because those NSAIDs vasoconstrict. So why are ACE inhibitors important? Heart disease is the leading cause of death in the United States. Stroke is the 5th leading cause of death, and kidney disease is the 10th leading cause of death. All of those causes of deaths are partially related to hypertension. And as I said here, 47% of adults have hypertension. So taking an ACE inhibitor can really just lower those risks of mortality and extend lifespan, lower your blood pressure, get more out of it. So, And then here are some sources I used from the Mayo Clinic, WebMD, the Cleveland Clinic, and then the CDC. Thank you very much for listening.